Alright guys, so we'll get to look at the next stuff, which is approach towards joint stiffness. Approach to joint stiffness. Alright, so this is it. Approach to joint stiffness. So it's basically how to clerk, a patient that has what? Joint stiffness. Alright. So many things that usually cause the joint stiffness is usually due to inflammation, or there's wearing out, So for the joint stiffness stuff, we said that the term stiffness actually covers a variety of limitations. So we consider 3 types of stiffness in particular. Alright. So let me say, if you are looking at a patient is stiff, it could mean that all the movements are basically absent. It could also be that, okay, there's movement, but all the movements are limited. There could be that, okay, there's limitation of the movements, but it's not all the movement. Okay, so looking at this, all movements absent surprisingly, although movement is completely blocked, the patient may retain some good functions that restriction goes unnoticed until the joint is examined. So sometimes you don't just believe everything that the patient tells you, you go and feel things for yourself. Okay, so surgical fusion is called what? Arthrodesis. Pathological fusion is called what? Ankylosis. So acute suppurative arthritis typically ends in what? Bony ankylosis. Tuberculosis arthritis heals by fibrosis and causes fibrous ankylosis, not strictly a fusion, because there may still be what? A small jog of movement. So all movements limited after severe injury. Movement may be limited as a result of things like edema or bruises. Okay, so with active inflammation of all movements, alright, all movements are restricted as we have active inflammation. So just trying to tell you that, okay, if you examine the joint of a patient and you find any one of these are the possible disease conditions that you should be suspecting. So all movements are usually restricted there and painful, alright, and the joint is said to be irritable. So in acute arthritis, spasms may be present, but a few degree of movement may be there. In osteoarthritis, the capsule fibrosis and the movement becomes increasingly restricted, but pain occurs only at extremes of motion. So some movements limited when one particular movement suddenly becomes blocked, right? So the cause is usually mechanical. Thus, a torn and displaced meniscus may prevent extension of some movements, but they are limited just because another movement is limited. You understand? So if you have a torn and displacement of meniscus, of course you won't want to extend your knee, right? So bone deformity may alter the arc of movement such that it is limited in one direction, right? Loss of abduction in coxal varies an example, but movement in the opposite direction is full and even increased. Alright, so that's it. Alright, basically an introduction to approach to joint stiffness.